Okay, welcome back, folks. We are nearing the time where we need to make our recommendations to appropriations by this time next week, essentially. And so I wanted to do another check-in with folks to see if you're having any barriers. This is the time to bring them up. Or if you feel like you are closing in on recommendations, or if there's any additional support that you need in order to make your recommendations to the committee, which we will be doing shortly. So so we don't need, sort of long drawn out things. This is essentially my check-in with teams to make sure that we're on schedule for filling out the chart. Remember, that's how your recommendations are going to come forward, and making sure that we'll be ready for next week. And also, if you are, I think that you need any language. So I'm thinking about GA is probably going to need some language that Katie has asked that we work with her sooner rather than later on that. Okay. And I know sometimes, Anne, you have requested language. So left-handed, let's just go to the left.
Sure. So we are waiting to hear from the department. This is for CDD within the DCF, and sent another series of questions. I think our team is narrowing down on what we think should be prioritized from the requests that have come in, and some things that we know that have been projects or things that are federal mandates, like the 7%. Co-pay rule, which I'm not going to bore everybody with right now. We're going to hear more about that on Tuesday next week. But so we have a good idea of, we have like 5 or 6 recommendations that we would like to include in the budget from, so essentially saying that instead of having all the funding that is not being used, which is the childcare contribution and the caseload savings, which amounts to a little more than 20 million, I believe. Instead of having all of that swept into general fund, that some of it be used for some of these initiatives that we're going to outline next week.
Okay.
But we are waiting for the department to get back to us, hopefully. But they're going to be here on Tuesday. So if we don't hear from them, at least Tuesday, we'll have an opportunity to talk with them and get more information.
Okay. So thank you. Just want to call your attention to our agenda for Friday, which is after House floor, which shouldn't be too long, but after House floor, we're going to be having committee discussion. So that's when I'll be expecting committee members to give us their first round of recommendations. Okay. So I just wanted to make sure that we're all on the same page. Okay. Next.
Yeah. So we have a meeting with OEO, we're honing in on our recommendations. We're hopefully meeting with the department during that committee discussion.
On Friday?
Yeah.
Okay.
Obviously not the whole part.
Okay.
So that'll be really for kind of finalizing, especially things like some of the bigger ticket items, like our recommendations around GA. But I think we're in a pretty good place. I'm hoping we'll be able to connect over the weekend once we've had that meeting to really kind of finalize our recommendations, and then work with Katie to get language ready for the following.
Okay. Well, no, for next week.
For next week.
Yeah.
Yeah.
Okay. Zon.
I think we're also doing pretty well. We met with Representative Bloomley and we have a meeting tomorrow with Dr. Levine to talk about a number of things, but the pilot recovery campus, and then and so questions about the opioid settlement, how those monies are being used. It's not quite clear to all of us, the monies that are being pulled out of the budget. They're not huge numbers, but where are they going and what exactly are they doing?
Okay. Would you also focus in on those prevention funds? The prevention funds are doubling from 3 million to 6 point something.
Oh, right. Yeah, no, that's definitely.
Is that on your list?
Yeah.
Okay. Because we have some questions about whether or not the most effective use of those funds is really going to prevention coalitions, which is, the department said prevention coalitions and high schools, but I'm not really, there's a small number of high schools that get grants now, and I'm not sure. We just need more specifics and
Okay.
really some probing questions about outcomes there.
Okay. All right, sure. Do you know, and you just said that, it's double,
Yeah.
from last year, that I don't know that from this. So, okay.
There's an additional 3 I can't remember exact, 3.75, 3.5, something like that. Yeah.
Okay. Okay.
And they're trading out general funds. So 3 million in general funds
Yeah.
going down. Okay.
I see that. Okay, great.
Okay.
Thanks.
I'm going to move around to the team leaders over here. Dan?
Great, thank you. We've been looking at the Dale budget, obviously, and we have a meeting tomorrow morning at 8 o'clock with Commissioner Bowen and her staff. And some of the things that we've kind of settled in on to really look at is the rate study. And, we've gone back and looked at what we funded in the past and how we can, put together what we should be recommending based on what the rate study had minus what we've funded in the past. And then we're waiting for some other numbers from the DAs and the SSA. So.
Okay.
Mhm.
All right. And Ann?
Yeah, we don't have anything actually new to report this week from last week. We are waiting numbers back from DCF. I just sent a reminder to
Okay.
Erica that we're hoping to get them soon. And we also have a meeting, requested meeting, actually lunch Friday, with Mentor Vermont. They didn't specify what their ask is. They did come last year and seek some additional funding. So don't have anything on it yet because we're yet to meet with them.
Okay.
And we do also have there will be a recommendation about maintaining the parent visitation, supervised visitation centers. Which are pretty small items.
Teresa suggested, not to put it in the emails, kin monies.
Yeah, to look into asking about, because there is some Chin's.
I just thought of it.
From Chin's, supposed to be Chin's redesign, there was several $million. We used some of it last year. And Nolan could help identify, there might be a funding source for things that you might recommend.
Okay. Yeah, the big black hole is, and that may be in part of that. I don't know. The quote Woodside.
No, it's separate. It's in the judiciary.
Oh.
It's money that's in the
The
judiciary.
visitation.
They were supposed to be a whole redesign of the Chin's process, and that actually never really happened. And there was money appropriated, and there was a work group that submitted a plan that the legislature didn't accept, and so that money's been sitting out there.
Okay.
And we used some of it last year, but for instance, it might be appropriate for the supervised visitation part that you're talking about. So I suggest that you check in with Nolan to see if he can identify that.
Yeah. Okay.
Okay. All right, folks. Just to update you on where we are looking, the 26th is our deadline. That's next Wednesday. In order to have that budget memo done, we have time on Tuesday. Lori, do we save time on Tuesday at all? No, Wednesday morning. Okay, thank you. On Wednesday morning, to do essentially what we'll be voting on Wednesday morning. Okay, so committee teams will make their recommendations, hopefully on Friday, as close as we can get. And then Wednesday will be sort of, voting on whether, this is in, out, people think it's a good idea to include. And, we will have to have some level of prioritization in our report, that we've been asked for that this year. And I think at this point in time, I think we're going to, because I want to ensure that we have appropriate access in each one of our sort of major areas. So I'm going to ask for what each area's number one priority is. So, you know, CDD, family services, economic and OEO, you know, the health department, and then Dale. You know, like what is the number one priority? And then we'll move from there. I want to make sure that each of the population bases and each sort of segment of Vermonters have some access to, you know, what we consider to be high priority. And then we may need to take a look at that again, but, you know, just so as you're thinking about that when you're making your recommendations to the committee, okay? Any questions about timelines, expectations, where we're headed?
All new to me.
Okay, all right, great. Thank you, everybody. Appreciate it.